We're talking with the Shadow Health Minister, Anne Ruston, and great to have you back with us again on Flow from Canberra.
My pleasure. Thanks for having me again.
Just generally, the sitting week in Canberra, has Medicare and the health system been a strong focus from the government from what you've heard in the Senate, but indeed in question time in both houses so far this week?
Well, look, certainly we've tried to prosecute a number of issues around health and aged care particularly, and we've certainly seen the media drawing attention to some of the failings in healthcare and aged care by this government. But the really sad thing is that when it comes to the legislative agenda, when it comes to the things that the government's doing, we haven't seen anything at all. In the Senate this week, barely any legislation at all. In fact, the only thing we've seen the government do is actually deny our requests for information on the spending of billions of dollars on infrastructure. So pretty disappointing. We'd like to see the government deal with cost of living pressures, because I reckon that's what most Australians are thinking about at the moment. And part of that is making sure that they've got affordable and easy access to a doctor when they want one.
Yeah, on that cost of living pressure of what you pay for a doctor, we're hearing that what people are paying in terms of a gap or no gap at all because the bulk billings vanishing from their clinics is growing. The federal government says, well, it seems to be saying, wait until the May budget, but isn't some relief needed now?
Look, absolutely, and I think that's the point. This government was elected on the basis that they said that they were going to strengthen Medicare and they were going to put the care back into aged care. They both sound pretty good. So far, we have seen no urgency whatsoever from the government about addressing any of these issues. In relation to Medicare, they've come out with a Strengthening Medicare Task Force report, but there's no detail. There are no timeframes, there's no additional money, and there's no urgency. They're basically saying you'll have to wait until the May budget. And so far, everything that they have announced, they haven't delivered. We haven't seen any delivery on their urgent care clinics. So I think, they really do need to start putting their actions where their mouth is. They made promises to the Australian public. Now they need to actually deliver them.
The Royal Flying Doctor Service spoke to us that one of their representatives was in Canberra for the release of their report about healthcare in the bush earlier this week, and they talked about, amongst other things, a stronger emphasis on primary care and even maybe relying on maybe nurses or even pharmacists to possibly provide more care. Is that acceptable, or is it sort of an acceptance that maybe the system is failing?
Well, clearly the RFDS is sort of one of Australia's favourite children. I mean, we all love the RFDS, and it was great to be there yesterday for the launch of their current report. But, they make a very good point about primary care. We need to make sure that primary care and prevention and early intervention is at the core of everything, because healthy people don't need so often to interact with the healthcare system. So that absolutely should be a focus. But the challenge that we have is that unless you have a coordinating point where the GP is the centre of that multidisciplinary care team that we know works best for Australians and their healthcare, it just becomes really confusing. So I think the government needs, they can make all these big headline statements about, we're going to full scope of practice and many different disciplines will be able to get access to Medicare rebates, etc., etc. How they go about doing that and making sure that Australians actually have coordinated care underpins the ability for this to be successful or not successful.
And it's well and good, I think, for the government and it's a good initiative from what we can see in terms of graduates and encouraging graduates to go to or stay in regional areas by waiving their help debt or HECS debt. But that's not going to solve the problem in the immediate term.
No, it's not. And first of all, the decision to waive the HECS debt was a decision of the former coalition government. This government has just chosen to follow through with it. But you're absolutely right. The core issue, the fire that's closest to our feet at the moment in healthcare is workforce shortages. We saw just this week that this government has prioritised skilled migration from overseas in the healthcare sector and the education sector only in the cities. 887 skilled migration visas, which are specific to rural and regional Australia, have been stuck in the go slow lane. So, for all of their rhetoric and all they say, they have actually neglected rural and regional Australia. They changed the distribution priority areas so that international medical graduate doctors no longer have to go to the country for a period of time. We've seen that they've put our visa applications for really important care workers have been put to the bottom of the pile. So they can say all they like. that they should be judged on their actions, and their actions so far have actually been to the detriment of rural and regional Australia's healthcare needs.
Just on that visa topic, I mean, first of all, are you hearing that there's a backlog in terms of processing of all the visas? Is there a need for more staffing in the immigration department to get some of those doctors, nurses, etc. into regions?
Well, certainly the only way that we're going to address the short-term workforce shortages across this country is by relying on overseas trained people to come to Australia. But we know that there's a two-speed processing activity going on in the Department of Immigration at the moment. There are those that have been fast-tracked by this government and those that have gone into another lane which are being left till later. We're seeing on average more than 2 years for the approval of a migration visa for somebody in rural and regional Australia in the critical areas of doctors, nurses, educators, so teachers, and care workers. You know, we have a crisis right now. 27 months, which seems to be about the average for the processing of these visas, is just not going to address the problem. So we're calling on the government, prioritise rural and regional Australia, don't make them poor cousins. And if you need to put extra resources on to make sure that we move these particular visas, well, so be it, because it is the only way we're going to be able to address the immediate problem. Then other initiatives need to come in to address the longer-term problem, like encouraging more of our medical graduates to choose general practice as a specialty.
Now, the Rural Doctors Association expressed frustration. I think they were pointing to a case study of an Irish doctor as a classic example where it may not be in the hands of the federal government, it may be the APRA, the regulator, not recognising qualifications in very similar countries and holding people up being able to get straight into practice. Is that something the federal government should step in and try and resolve?
Well, absolutely. We need to be fast-tracking access to properly and appropriate qualified medical professionals and do it as a matter of absolute urgency. Of course, no one expects that we should be letting anybody into this country to practice without the appropriate qualifications, and that's absolutely essential. But when you consider that the time it takes for the processing of an application of somebody, as you say, an Irish doctor, or we've got many doctors coming out of the NHS who are keen to come to Australia, if they're put into this go slow lane and they're not getting their applications processed quickly, they'll probably go to Canada. They'll probably go to New Zealand. We need to have a processing mechanism that's at least commensurate with other countries that also have a high demand for these really important medical specialists. And so, yes, we do need to have a look at how we're processing. We do need to make sure that we've got the quickest way of getting people ready to practice in Australia. But, notwithstanding that, we shouldn't cut any corners around making sure that these people are appropriately trained to operate in Australia. But if other countries are doing it in a quarter the time we are, then there's some questions to be answered.
Now, just lastly, I know you've got to dash back into the Senate, but on that 887 visa that you raised, you say they're all heading to the suburbs or the metropolitan areas. Is there something the Coalition can do in the Parliament, in the Senate? Is it something that can be reviewed to try and force the regional areas to be included in the consideration for those priority visas?
Well, we asked the Minister representing the Minister this week about the issue. We didn't get much of an answer, but no, we will continue to prosecute this, and we will continue to put the pressure on the government to change this. I mean, unfortunately, as the Senate sits at the moment, we don't have the numbers, but I think there's a pretty strong argument, and I reckon the crossbench would be certainly pretty interested in helping us make sure that people in rural and regional Australia had the same access to healthcare workers as everybody in the city seems to be getting.
Yeah, I would have thought Lydia Thorpe, now she's put her flag in the ground as someone other than the Greens representing Indigenous people, might be interested in supporting something for regional Australians.
Yeah, possibly, and I also think that maybe even having a chat to the Greens, because I think we've got a pretty reasonable request here for the government to include 887 skilled migration visas, rural specific, into their expedited fast lane. And not leave them languishing at the bottom of the pile.
Anne Ruston, South Australian Senator and Shadow Health Minister, thanks for your time today. We'll let you go to the Senate.
Thanks, my pleasure.